Obesity is major COVID-19 risk factor, says French chief epidemiologist. I've dropped from a BMI of 42 to 34, so still obese, but all my blood tests show massive improvement and still losing weight. I feel a lot healthier and don't get sick anywhere near as much. In the UK they have stated that anyone with a BMI of 40 plus should be isolating themselves in the same way as a person 70 plus. I'm glad I chose to get healthier when I did. Obesity usually leads to a cluster of the comorbidities that can lead to complications with this disease. With America at something like 40%, 70% overweight or obese, and 100 million with diabetes and prediabetes, there could be a struggle in the coming months. These numbers are a maddening indictment of the U.S. public health and lack of a strong culture of preventative medicine, coupled with a weird anti-intellectualism and a healthcare system that is profit-based and leaves those who can't afford without an appropriate standard of care. Unfortunately, a lot of Western world is not far behind. Canada is a fat country, the UK and Ireland are fat too. Edit, my percentage of fat people was off. Jesus fuck, obesity is major everything problem. There's really zero upside to being fat. Edit, I stand corrected, you're harder to kidnap. However, if they really want you, they'll make accommodations. Also, it could be a con in the rare case they think, well, we can't bring him with us, so might as well kill him. I read the headline as French chef epidemiologist, which just goes to show why I am obese. I believe it. I, 35F, used to be over 300 pounds. My highest ever recorded weight was 320. I would get colds 2 to 3 times a year that would take a good couple of weeks to kick. In 2019 I had bariatric weight loss surgery at 309 pounds, I am now at 150. Not once in the last almost 2 years have I got sick, and I truly believe my immune system has vastly improved. Good thing everyone's been at home, sitting on the couch, and stuffing themselves full of snacks. I did wonder when this was going to come out. I had seen a few things that lent towards it, but no one explicitly saying it. I wonder how much of it is down the body's lowered immune system, overall health, and how much it's about the additional strain on the heart. The American South is fucked then. I've known a couple people with it. The two who are healthy weight took it like a nasty cold. The one who is obese has been in the hospital 5 days. The entire southern United States. Chuckles. I'm in danger. Rip Reddit. Removed. I think many people don't understand that obese doesn't mean morbidly obese. Many people are considered obese without being that big. Shit, I'm fucked if I get it. This year has been awful and I thought I was finally getting ahead. At least I've lost 30 pounds in the last 3 months. We are seeing that anecdotally a lot, in stories about young and youngish dead patients. Obesity is going to be addressed as a public health problem a lot more aggressively after this in many countries, and I think the message will be easier to pass now. It is not worth doing anything about it right now, except maybe talk of it so those more at risk can be more careful at protecting themselves. Eat reasonably and healthily, be extra careful at preventing risk of infection, do not stress. These articles absolutely terrify me as a young male with a BMI over 40. Been following CICO again for 3 weeks and I'm down over 20 pounds. Been isolating like my 65 years old father with a heart condition. Just hoping I can drop enough weight. Obesity increases your risk factor for literally everything. There was also a data point from the UK that the morbidly obese, BMI 40, were only like 6% of deaths. I assume that the data wasn't normalized for the populations. I'm not sure why. This is why I laughed when I saw all those Americans yelling different demographics than China in early February to claim that we would have a massively lower death rate. 99% of Redditors just got sweatier. I hope the post-COVID world will promote getting help to employees and citizens for lifestyle changes. I'm obese and have been terrified of catching the C since it hit American because I know I'm already not healthy. I've known I need to lose weight for a while now but never had the drive to do it. This might be the thing that gets me motivated. I think this is a wake-up call to me personally, and I hope a lot of others in my situation. I lost a bunch of weight about 5 years ago and managed to get down to 212, but I'm back up to 290 at my recent visit to the doctor's office, and I thought I was still safe. I'm 30 years old as of a couple days ago, and I don't want to be unhealthy going into my 30s. I'm currently self-isolating way more than the people around me, but I see that isn't enough now. I'll be working on eating better and working in exercise to my routine. Hypertension and diabetes are established comorbidities with coronavirus, and both are common in obese patients. I think it does more good to talk about how COVID-19 actually functions based on our current understanding, though, rather than just saying X group is at risk or Y group is not at risk. Coronaviruses like COVID-19 infect through an ACE2 binding site. ACE2 is an enzyme which dilates your blood vessels and is upregulated in those with hypertension as your body attempts to lower your blood pressure by producing more of it. This is also why people at risk of getting COVID are currently advised not to take ibuprofen, as that drug further upregulates ACE2. When the news mentions that a patient who died had a pre-existing medical condition that may be simple hypertension or diabetes, especially if they were being treated with ACE inhibitors or thiazolidinediones. COVID causes respiratory distress by infecting type 2 pneumocytes, which produce pulmonary surfactant in your lungs. That is effectively the substance which keeps your lungs from sticking to themselves. So people with COVID can gradually lose lung capacity as the disease progresses, until eventually they are unable to breathe without ventilator assistance. Once they're on a vent, they'll need to stay there until the virus runs its course and their body is able to produce new pneumocytes. Most people don't get to that stage as their immune system is able to keep the virus in check. Any advantage you give to the virus will make that less and less likely, though. Those with hypertension/diabetes, compromised immune systems, or pre-existing respiratory conditions seem to be the ones most at risk, which aligns with the current understanding of how the disease infects and progresses. Obesity is not good for any of those factors, of course, but obesity itself isn't necessarily where your focus should be if you were trying to assess your own risk. Obesity is a major risk factor for basically everything. LOL. When is obesity not a risk factor for anything? Well, duh. So is high blood pressure, diabetes, and any other big health issue. Also, sitting at home is increasing these issues tenfold. Just a PSA, if you are currently overweight or obese, it is absolutely a great idea to start eating a healthier and more balanced diet, with plenty of fruit and veg. Regular exercise is also a great way to feel good, assist with your weight loss, and pass the time during self-isolation. It is very much not a good idea to begin a crash diet. Attempting to lose huge amounts of weight in a very short time will wear down your immune system and would be extremely counterproductive if you are losing weight to protect yourself from COVID-19. Reading this as a 6'2", 250 pounds guy. Well, guess I'll die. In the last year I saw a lot of body positivity/no fats haming people advocating that being fat/obese is nothing to cure and you shouldn't mind being fat. A lot of this messages were directed to teens and children. IMHO, this is very wrong. Obesity is like smoking, it is one of the major causes of a lot of dangerous diseases. Corona is just one of them. Well, duh, what isn't obesity major risk factor for? You basically clutter down all your vital organs, pretty obvious if you ask me.